I'm Shaniqua Bogues. I'm in the Department of Medicine, Division of Geriatrics. And so just to start out, I'll just tell you a little bit more about myself. I was born and raised in South Carolina and then ended up in Wisconsin following my residency in Alabama. I came here to pursue a geriatric fellowship and stay for additional training to focus more on research. In the area of dementia and aging due to family experiences, my academic experiences here in Wisconsin, as well as the appreciation from the patient population we've served here in Wisconsin, as well as Alabama and my other training in South Carolina. So the plan for today is to define some common terms related to memory, discuss some types of dementia, risk factors for dementia, as well as providing a brief overview of our Building Bridges project. I'm going to start off by presenting the main message of this talk first, and then reflecting on it at the end of this talk as well. So basically the high points for today is to make sure everyone is aware that dementia is not normal aging, and age is the greatest risk factor for dementia. It's an increased risk of dementia in Blacks or African Americans, and then also just to discuss a community involvement project. So cognition is our basic understanding of things. When we mention Alzheimer's disease, this is a type of dementia, but not dementia all by itself. It's just one type. Cognitive impairment is abnormal memory loss. And then when we talk about dementia, dementia is a term, it's like an umbrella term, which we'll discuss later on as well, to discuss a syndrome or group of symptoms that are impacting our memory. And so I just want to start off talking about Joyce's story. So Joyce has been taking medication for high blood pressure and diabetes for several years. She's lived alone and driven for more than 50 years. However, recently, Joyce's daughter had to help her find her way home from a frequently visited store. And then at Joyce's follow-up health visit, her blood sugar as well as blood pressure were elevated despite her taking her medications. When Joyce's daughter checked her pill box, no pills had been taken for the entire week. So I present this story of Joyce just to have you reflect on this story and think back if you experienced this with a friend, relative, and then we'll discuss this further at the end of the talk. And so normal changes with aging is our body just starts to slow down. That means we don't think as quickly as we used to. We don't move as fast as we used to. And also the processing of information, reacting to responses, all of those things tend to be slower. An individual starts forgetting occasionally, but most importantly, you still retain your functional independence or your ability to carry out those normal day-to-day activities. And I'll discuss this more later on. And so with abnormal aging, this is someone who's starting to forget frequently. They have trouble recalling names, locations, just conversation, maybe more repetitive. And then once this abnormal aging progresses, and then it starts to impact your day-to-day activities, like managing your medications, driving, managing finances, then this is when we say an individual has dementia. And so there are different forms of memory loss. And I use this image with a tree. And you see initially with normal aging, the leaves are green and healthy, and then the tree is full of leaves. However, as the tree gets older, the color of the leaves start to fade as well as fall off of the tree. And we can relate this similarly to what happens as we age, what's happening with our brain. As we get older, our brain is changing, it's getting smaller. Why? Because we're losing the leaves off of that tree, or basically that means your brain cells. You have the brain cells dying. And as someone progresses, say to abnormal memory loss, or we'll typically say a neurodegenerative process, that's when you're losing those leaves and you're losing those brain cells. And so you go from a mild cognitive impairment where the person has abnormal memory loss, but yet they're still able to carry out those normal day-to-day activities. And then once those day-to-day activities are impacted, trouble cooking, trouble managing your finances, then this is what we call dementia. And this table just basically summarizes this once again, making sure we just highlight with normal aging, you occasionally forget. However, the person is still able to carry out those normal day-to-day activities, as opposed to dementia, you're forgetting more frequently, and that's what starts to impact your day-to-day activities or your daily function. So once again, dementia is an umbrella term that's used to describe a group of symptoms, basically this affecting our brain. So difficulties with memory, language, problem solving, or multitasking, and impacting your day-to-day activities, managing your finances, medication management, shopping, your ability to use technology, all of those type of things. And then on the right side, we're showing dementia as that umbrella term to describe the many different types of dementia. And so in 2020, there's about 56 million people 65 years of age and older who have dementia. And they're projecting this rate to go up as our population continues to age. And so estimating about 88 million people by the year of 2050. Of this 56 million, 5.8 million have Alzheimer's disease. And 1 out of 10 of those are 65 years of age or older. The pie chart on the right side highlights the significance of increasing rates of dementia with increasing age, with this the purple portion showing individuals 75 to 84 years of age. And the light green is 85 and older. But basically, as you get older, your risk is getting much greater. So in Wisconsin, it's about 120,000 individuals with Alzheimer's disease. And once again, the cases are increasing with increasing age. As we can see on this right side, those 85 years of age and older, they project it's been 50,000 people compared to just 17,000 in the age group of 65 to 74. They expect an 8.3% increase in 2050. And then also in 2019, it was 84 geriatricians in the area. And now with the increase in population as we continue to age, and that expected 8.3% increase, they're anticipating, or they estimate, a 225% increased need for geriatricians in the year 2050. So Alzheimer's dementia is the most common type of dementia, about 60 to 80%. It's the 6th leading cause of death in the US, but what's more concerning is it's the 5th leading cause of death in Blacks or African Americans, because we are affected twice as common as Caucasian or white population. And then Hispanics have a high risk of, or higher prevalence of getting dementia as well. This pie chart shows Blacks or African Americans and Hispanics because these are the populations from the underrepresented groups who they have larger sample sizes. And out of having these two groups, they still have a higher prevalence than the white group. And so Alzheimer's dementia, once again, is the most common. Vascular dementia, second most common. But keep in mind, you can also have a mixed type of dementia. And so that's a combination of any of these underneath that umbrella term. So when thinking about the risk factors for dementia, we like to think about irreversible causes, with age being the greatest risk factor, genetics, family history, but then also some reversible causes like medical history, brain trauma, brain injury, behavioral, diet, sleep, exercise, mood, or medication. Because if it's a reversible cause, we can potentially target those factors and try to improve that individual's cognition, slow that process, or sometimes even reverse it. So if someone has mild cognitive impairment and is not due to Alzheimer's disease, but instead due to one of these reversible causes, we have the potential to correct that factor. Say if it's medication that's impacting someone's memory, you make those adjustments to the medication, and that person can possibly go back into normal memory. And so, how do we reduce these risks? Once again, addressing healthy lifestyle choices, keeping the brain active. Exercise is vital to brain health, very important. Getting resources, but also sharing those resources with others in the community to make sure we'll all stay aware and informed. And so, speaking about community engagement, I just want to speak about our Building Bridges project, which is working to increase the dementia awareness. The purpose of this project is to examine the impact of community engagement activities, looking at trusted medical researchers, as well as a willingness of participants to participate in research studies. And so basically throughout this project, we want the community to be involved, from group discussions on deciding on topics, getting your input, as well as presentations providing a dementia overview. In that stage of the project, we ask for your input through a survey prior to as well as after a presentation, and then also a medication review session, which is a one-on-one session with a participant where we sit down and review your medications and identify any medications that may be potentially impacting your memory. So you can bring that up, and that opens discussion with you and your provider, and weigh the risk and cons, pros and cons, to see if that medication is still needed. Maybe a dose can be reduced, but anything we can do to improve your overall brain health. And throughout that session, we will still ask for a survey, getting your input prior and after that activity. So now, wrapping up, going back to Joyce's story. So just two things I wanted to highlight. Well, a couple things to highlight with Joyce's story. Joyce definitely is showing some functional impairments. So if Joyce was presented with memory loss that was concerning, either by her or a relative or friend, and then also showing these functional impairments where she can no longer find her way home from a frequently visited store, but also she's having some difficulties with medication management. Joyce may potentially fit under the category for dementia. However, we could not definitively give her that diagnosis until we actually further investigated Joyce's medical history, get more history from a friend or relative, and also adjust her medical comorbidities, because she's coming in with elevated blood sugars, elevated blood pressure. So maybe we don't know how long these values have been elevated, but that will definitely impact Joyce's cognition as well. So maybe sometimes just getting those things under control may help also. And so back highlighting an important point, just to know that dementia is not normal aging. Age is a huge risk factor for dementia. And then it's an increased risk in Blacks or African Americans. And then also highlighting the importance of community involvement to help increase dementia awareness. And so now I'll take any questions if there may be any. And then I would also like to thank you for your time. So thank you so much for your question. And so if anyone is interested in becoming involved in the Building Bridges project, you can contact me, and you can contact me by emailing me. And that would be my last name, which is Bogues, Bouges, at wisc.edu. So Bouges at wisc.edu. Or you can send me a text so I can I can reach you at 608-620-0961. And thank you for that question. And so for eligibility for the Building Bridges project, we're trying to recruit Black or African American participants who are 45 years of age or older, and no formal diagnosis of dementia. So I would like to thank each and every one of you for taking the time out to join in on this Facebook Live session. I really do appreciate the opportunity to speak with you, and I look forward to hearing back from anyone who's interested in participating in the project. And definitely feel free to join in on another session. We have 3 more coming up this month on Thursday, same time. Thank you once again.